Hi guys, this is Dr. Rajeshwar from YR Pharma Tube. In the previous video, we discussed on the introduction, chemistry, structure-activity relationships and the mechanism of action of phenothiazines. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of medicinal chemistry, click on the links given right below this video. In this lesson, we shall learn some of the clinically used individual phenothiazine drugs such as Promazine, Chlorpromazine and Triflupromazine. The first drug of this lesson is Promazine. Promazine was approved for medical use in the US in the 1950s, although it is no longer commercially available. It is a traditional, typical first-generation antipsychotic drug with antiemetic activity. Its IUPAC name is N,N-dimethyl-3-phenothiazine 10-yl propane 1-amine. It is a substituted phenothiazine derivative in which the ring nitrogen at position 10 is attached to C3 of a N,N-dimethyl-propanamine moiety. In other words, it is a phenothiazine tricycle that has a 3-dimethylamino-propyl group at the N10 position of the phenothiazine. It is a member of phenothiazines and a tertiary amine. It has a role as an antipsychotic drug, an antiemetic, a dopaminergic antagonist, a H1 receptor antagonist, a muscarinic antagonist, and a serotonergic antagonist. Promazine is synthesized in a single-step reaction by the alkylation of phenothiazine with 3-dimethylamino-propyl chloride in the presence of sodium amide. It is a white or almost white crystalline powder and is slightly hygroscopic. It is very soluble in water and soluble in nonpolar solvents like in methanol, ethanol and chloroform. It is practically insoluble in ether and benzene. Promazine hydrochloride is stable at the pH 6.5. When heated to decomposition, it emits very toxic fumes of nitroxides and sulfoxides. Promazine acts by blocking a variety of receptors in the brain, particularly dopamine receptors. Dopamine is involved in transmitting signals between brain cells. When there is an excess amount of dopamine in the brain, it causes overstimulation of dopamine receptors. These receptors normally act to modify behavior and overstimulation may result in psychotic illness. Promazine blocks these receptors and stops them becoming overstimulated, thereby helping to control psychotic illness. It has weak extrapyramidal and autonomic side effects which leads to its use in the elderly for restless or psychotic patients. Its antipsychotic effect is also weaker and it is not useful in general psychiatry. Promazine is sold under the brand name Sparin. It is chiefly employed for short-term treatment of disturbed behavior or psychomotor agitation and is also used as an antiemetic drug. It has weak antipsychotic effects but is generally not used to treat psychosis. Its use is limited in people but is used as a tranquilizer in veterinary medicine. It is given by mouth intravenously or intramuscularly. The next drug is chlorpromazine. Chlorpromazine was developed in 1950 and was the first antipsychotic drug on the market. Its introduction has been labeled as one of the great advances in the history of psychiatry. Chemically, it is known as 2-chloro-10,3-dimethylamino-propyl phenothiazine. It is a typical antipsychotic phenothiazine in which the ring nitrogen at position 10 is attached to C3 of an N,N-dimethyl-propanamine moiety. It has a role as a phenothiazine antipsychotic drug, an antiemetic, a dopaminergic antagonist, and an anticoronaviral agent. It is a member of phenothiazines, an organochlorine compound, and a tertiary amine. Chlorpromazine can be synthesized by sulfurization of metachlorodiphenylamine giving 2-chloro and 4-chloro isomers. Separating 2-chlorophenothiazine from minor 4-chloro isomer and reacting the 2-chloro isomer with 3-dimethylamino-propyl chloride in the presence of sodium amide yields chlorpromazine. Chlorpromazine is a white or creamy white powder or waxy solid which is practically insoluble in water. It should be kept in a well-closed container and protected from light. It decomposes on exposure to air and light, becoming yellow, pink, and finally violet. It is very soluble in water. Chlorpromazine acts in a similar way as that of promazine. It has a wide range of activity arising from its depressant action on the central nervous system and its alpha adrenergic blocking and antimuscarinic activity. The drug possesses antiemetic, serotonin blocking, and weak antihistaminic properties. It has membrane polarizing property and hence it has local anesthetic action. Chlorpromazine, it is marketed under the brand names Thiorazine and Largactil. It is primarily used to treat psychotic disorders such as schizophrenia. Other uses include the treatment of bipolar disorder, severe behavioral problems in children including those with attention deficit hyperactivity disorder, nausea and vomiting, anxiety before surgery, and hiccups that do not improve following other measures. It can be given by mouth, by injection into a muscle or into a vein. And the last drug of this lesson is triflupromazine. Triflupromazine is an antipsychotic medication of the phenothiazine class. Its IUPAC name is 2-trifluoromethyl-10,3-dimethylamino-propyl phenothiazine or NN-dimethyl 3,2-trifluoromethyl phenothiazine 10-il-propane 1-amine. It is a member of phenothiazines, that is 10-H-phenothiazine having a trifluoromethyl substituent at the second position and a 3-dimethylamino-propyl group at the N10 position. It is a member of phenothiazines, a tertiary amine and an organofluorine compound. It has a role as a first-generation antipsychotic drug, an antiemetic, a dopaminergic antagonist and an anticoronaviral agent. Triflupromazine is synthesized by the alkylation of 2-trifluoromethyl phenothiazine using 3-dimethylamino-propyl chloride in the presence of sodium amide. The starting material 2-trifluoromethyl phenothiazine may be prepared by the reaction between a compound having an activated chlorine, that is 6-chloro-3-trifluoromethyl nitrobenzene, and orthobromothiophenol to give the thioether. The nitro group of the thioether is then reduced to form an aniline. Heating this aniline derivative in a solvent such as dimethyl formamide leads to displacement of bromine by amino nitrogen and forms the 2-trifluoromethyl phenothiazine. Triflupromazine is a white to pale yellowish brown crystalline powder which is soluble in water and acetone and insoluble in ether. Its solutions are sensitive to air and light. Triflupromazine's actions and uses are much similar to that of promazine and chlorpromazine. It binds to the dopamine D1 and D2 receptors and inhibits their activity. The mechanism of antiemetic effect is due to predominantly to blockage of the dopamine D2 neurotransmitter receptors in the chemoreceptor trigger zone, that is abbreviated as CTZ, and vomiting center. Triflupromazine blocks the neurotransmitter dopamine and the vagus nerve in the gastrointestinal tract. It also binds the muscarinic acetylcholine receptors M1 and M2 and the tryptamine D receptors, that is 5-hydroxytryptamine 2B. It is sold under the brand name Vesprin. It is mainly used in the management of psychosis, that is as an antipsychotic agent, and also used to control nausea and vomiting. It is used for severe hiccups. This is the list of references followed for the lesson. That's all in this video. The individual phenothiazine drugs such as promazine, chlorpromazine and triflupromazine. We will discuss the other phenothiazines in the next class. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.